Hello, myself Dr. Pravin Borasadia. I am practicing as a consultant gastroenterologist at Vedam Hospital, Surat. In pancreatitis, particularly in acute setting, in some complicated cases where IR helps a lot to manage the patient, wherein peripancreatic collections, patients are in critical phase and surgeries should be avoided. In such cases, if the pancreatic collections are infected, where IR can help us to drain the collection and we can save the patient. In complex cases in gastroenterology services, interventional radiology and gastroenterologists work in a team in synchronized manner in which patient gets the best result with least morbidity and least complication. Recently we had a case of acute pancreatic collection. Patient had internal bleeding due to pseudoaneurysm from the vessel. Such patients are at very high risk of anesthesia, so that patient was managed by interventional radiologist team just by embolizing the aneurysm, and patient was saved from major surgery. We usually explain that this procedure is minimally invasive. In majority of the cases, it is just like getting a puncture in your vein. Majority of the procedures do not require any major anesthesia. They are done under local anesthesia. Patient can safely go home after a daycare procedure within few hours. So patient need not to stay in hospital for prolonged. Where there is acute pancreatic and peripancreatic collection, where we suspect of infection, where intervention radiologist put drain and drain the infected collection. That is how we can avoid the surgery. That is how they help. Yes, awareness about IR among patients is very low, and usually I explain to patient about IR procedure is that it is a very minimally invasive procedures, and majority of the time it is just like single prick, like taking a IV cannula. It avoids major anesthesia risk. Patient can go home safely within few hours after completing the procedures, and further it is having low morbidity and low mortality rate.